I'm the Florida Coalition's Director for the Concerned Veterans for America, better known as CVA. CVA is a nonpartisan, not-for-profit organization that is known as the voice for veterans, the voice of veterans for freedom and prosperity. Today, we'll be discussing the Veterans True Choice Act and the future of veterans healthcare. Joining me today is the sponsor of the Veterans True Choice Act, Congressman Greg Steube from Florida's 17th Congressional District. Congressman Steube himself, a veteran, and was formerly a Florida state representative where I had the privilege to serve with him. Also joining us is Concerned Veterans for America Senior Advisor Darin Selnick, a retired Air Force veteran, former Senior Advisor to the Secretary of the VA, former Veterans Advisor for the White House Domestic Policy Council, and CVA subject matter expert on healthcare policy. It's an honor to have you, Congressman, and you, Darin, with us today. And before we go any further, Congressman, if you would like to go ahead and start this discussion by maybe making an opening statement.
Yeah, thanks, Jimmy, and thanks for having me. It's good to see everybody again, and I'm very appreciative that you guys are willing to have this for the audience to be able to kind of listen to what we're trying to do in Washington. What I'd like to do at first is just kind of tell you why I think this bill is important, and then we can kind of dive into the bill itself. This kind of came from the aspect in a district like mine, especially where you have a very rural area, where vets were going 3-4 hours to the VA hospitals because they don't have a hospital in their district. They didn't really have clinics in their districts. And if they did have clinics, they were very small clinics that didn't do a lot of different things. So this would give veterans the ability to get TRICARE, especially for our rural veterans. There's a former ranking member out of Tennessee. He had a 5-star VA hospital in his district. All his veterans went to that 5-star hospital. So for veterans like that, they want to keep the VA, they can do that. But for a lot of places, especially in rural Florida, especially across the country where they don't have the opportunity to go to a VA healthcare facility, this bill would open up those opportunities to get the type of healthcare that our vets deserve.
Well, I appreciate that. Thank you very much for that opening. One of the questions that we have, Congressman, is, what kind of constituent services does your office offer veterans? What are some of the challenges veterans are regularly facing accessing VA services that you've heard?
Yeah, the biggest challenge for veterans in my district, and I'm sure this is across the country, is getting their benefits, going through the VA process. And what a lot of veterans don't understand, which I think is important, is whatever congressional district you live in, you need to reach out to your congressman or congresswoman to have them start a case for you through their congressional office. And once a congressman or congressional office starts a case, that gets a lot more attention from the VA. We have caseworkers, that's all they do is work for our office and do casework specifically on these issues. So say you haven't gotten your disability payment, say you haven't gotten the disability rating that you think you should get, all of these types of things we can work on at the case basis. And we've had a very good response rate from the VA when we open cases. And there's a lot of veterans in our district who didn't even know they were eligible for benefits that they now get because they opened the case in our office. So I would encourage anybody watching, if you have a VA issue and it's something that a congressional office can work a case for you, don't hesitate to reach out to your congressman. That's our job. That's how I view our job as our most important aspect is serving the constituents in our district. And so if you have questions about the VA, you have questions about eligibility for benefits, you should not hesitate to contact your member of Congress, because they could open a case for you, and that case could be a windfall for you for past payments, could be a windfall for you to get the care that you deserve and the benefits that you are due.
Well, Congressman, I greatly appreciate that information. One of the things is you recently introduced the legislation, HR 364, the Veterans True Choice Act, and you talk about more control over the veterans' healthcare decisions. Why do you think that the True Choice Act, the Veterans True Choice Act, is needed to give better control over their healthcare choices?
Yeah, so what the bill would do is allow anybody over that 30% disability who would have eligibility to get services through the VA, it would give them TRICARE Select or TRICARE Prime, TRICARE for life. So if they want to continue to utilize the VA, they absolutely could do that. But if they have a community healthcare provider they would prefer to go to, or the VA hospital is miles away or 3 hours away, and they don't want to have to drive that way, they can get whatever healthcare they need and deserve right there in their own community because they have TRICARE for Life or TRICARE Prime. So it would really give a lot true choice, is why we call it the True Choice Bill. It would give true choice to the veteran. There are a lot of older guys who don't live far from the VA hospital. They like going to the VA hospital to talk to fellow veterans, and they enjoy the service that they get in the VA. This wouldn't change that for them. They can continue to take advantage of that service. But if you're a young veteran and you're working and you don't have time to wait, 2 hours to get your appointment, or to drive 2 hours to get to the hospital or the clinic, you could go anywhere you needed to go that takes TRICARE, and you can get the medical care that you deserve. And I actually think this would have a huge impact on veteran suicides that we're seeing across our country, because instead of having to wait either on a wait list through the VA or have to wait through the VA system to get a mental health provider, you could go to a mental health community care provider right there in your community at the moment in time that you're in crisis or that you need it. And I think you would see a big change in the rates that we are having in veteran suicide in our country right now.
Well, and for those who are just coming into the live feed and everything, my name is Jimmy T. Smith with Concerned Veterans for America, and we are joined today with Congressman Greg Steube and Darin Selnick from CVA, who is a senior advisor. And Derek, this question is to you. How is the Veterans True Choice Act different from the current healthcare options the veterans have through the VA, and what does it do? And not to be duplicative of what the congressman already said, but what does it do and maybe do differently?
Yeah, so I want to thank the congressman for his leadership on this. There's a lot of members on the Hill that support veterans, but they're not willing to take a leadership position and actually figure out solutions and do what's right. This bill is a very obvious solution. I wish I had been the one who thought of it, but I hadn't been. Congressman Steube did. It's very simple because we're talking about a successful DoD program. Now, I am in the successful DoD program as a retired Air Force. And so Mission Act was never meant to be the final solution. Mission Act was meant to, as Congressman Steube mentioned, be the equivalent of one of the DoD programs, which is a TRICARE Prime with access standards. But the intent was, after getting that up and running, was to go ahead and go forward with full choice. Now, every other American, whether you're military, Medicare, even Medicaid, in federal healthcare programs have full choice, except the veterans in the VA, and the VA has really kind of botched it, especially since COVID-19. So veterans who use the VA system are the only Americans who don't actually have true choice. Why is that important? That's important because you have good and bad in every healthcare system. You have good and bad at DoD, you have good and bad at VA, you have good and bad at the private sector. The difference is, if you're using the DoD program and you don't like Camp Pendleton, then you can go ahead and go to TRICARE Select, and you can go ahead and pick a PPO and pick whoever you want. But if you're in the VA and say San Diego's not working for you, then you're stuck. In the VA system, they pick your doctor, they pick your hospital, and then they have a lot of latitude, even with the Mission Act, even with the right of access standards in terms of distance, to either be very slow or to deny it. And we do know full choice in the VA works because we do have one little sliver of it, and that is urgent care. And I challenge people to tell me, I haven't heard any testimony, I haven't seen any newspaper articles. Urgent care, where you can go to any provider in the network, as long in the network, veterans have that full choice, and there have been no complaints on urgent care, no complaints on getting it. VA can't stop it; they have no role in it, and veterans have been able to get their urgent care. And so that's the idea. That's how it works with the DoD programs. They're both federal programs. They're both proven. The DoD program is more efficient. It's more cost efficient. Veterans are very happy with it, and so that's the point. But the key thing is, veterans need, if it's not working for them, the choice. If it's working for them, great. If it's not, now. It's important to point out real quick why this is important, because and how the VA system has not been working even as intended for the limited choice. We recently had an entire 10-member state of Washington delegation put a letter out talking about how bad the problems were with VA operating its healthcare and its community care. Quote from the entire bipartisan 10-member delegation: veterans have experienced long wait times for appointments at VA facilities as well as with community providers. Phone calls go unanswered, appointments are delayed, and community providers often wait up to 2 months to receive authorizations for necessary medical care. Massachusetts delegation a few months had a similar letter. That's unacceptable. The only way to fix, and I have 2 decades of working with this, the only way to fix VA is for the veterans to be able to choose what works best for them. Then VA will fix itself if it knows that veterans can go to another federal program. So once again, thank you, Congressman Steube, for putting together this very needed piece of legislation.
Well, once again, for those people who are just joining us, my name is Jimmy T. Smith. I'm the Florida Coalition's Director for Concerned Veterans for America, and we are joined today by Congressman Greg Steube from Florida's 17th District, and by Darin Selnick, who is the Concerned Veterans for America Senior Advisor. And we are discussing the Veterans True Choice Act and the future of veterans healthcare. So let me bring up this next question, and I'll defer first to Congressman Steube, but it's for both of you. One thing we saw coming out of the pandemic was over 20 million canceled appointments at the VA, and concerns regarding whether the wait time being reported from the VA accurately reflected veterans' experiences. First, is this obviously a concern to you, and have you heard these comments within your district? And then specifically, how would this bill potentially fix that issue by removing the barriers for veterans currently facing the care they're receiving?
Yeah, and Darin kind of touched on this on the Mission Act. So when the Mission Act passed, it was a great step, like he said, in the right direction. But the challenge with the Mission Act, in order to have choice in your healthcare providers, is if the VA is meeting certain time periods or distance requirements. So say if they can get you an appointment with an orthopedic within 30 to 60 days, then you still have to stay in the VA system. So that obviously creates challenges when you need your health care sooner than that, or you have to travel a certain distance. As long as it's underneath that distance requirement, you still can't opt out of the VA care. You still have to go through the VA care. So you've got veterans that are waiting 30, 60, 90 days to get care. And some of the things that were happening that I was hearing from some of my constituents is, in order to meet those time periods for that 30 or 60-day appointment, is they'd make the appointment knowing that they couldn't hold it. The veteran would show up to the appointment and be like, I'm here for my appointment with the orthopedic. And then the VA would be like, oh, I'm sorry, they had to cancel. We're gonna have to reschedule you. So then they'd reschedule you for another 30 to 60 days out. And so it was really like a 90 to 120 days before you were actually seeing the care provider. And the care provider always changes. I still go to my VA clinic every year for my primary care. I do it just to see the type of care that our veterans are getting. I've done it now ever since I've been back from the service in 2008. And every single year that I go, I have a different physician. The different physician is, of course, then trying to learn who I am and what my health issues are, and to give you the type of care that you need. If you had true choice in this bill, you wouldn't have to deal with any of that. You wouldn't have these distance requirements. You wouldn't have these time requirements. You would have true choice. So say you have a hernia and you need your hernia repaired, instead of waiting 30 to 60 days to go to the clinic, who then in the VA is going to say, okay, yep, you have a hernia. Now we're going to set you another 30 to 60 day appointment to see the hernia repair doc. And then you do that and you drive 2 or 3 hours away to do that. Instead of doing that, you go to a hernia repair doctor right there in your community. I live in Sarasota. You could go right here in Sarasota, go to that doctor. If they take TRICARE for Life or TRICARE Prime or TRICARE Select, then they'd be able to do that procedure, and it's not going to cost you anything. So again, if you're a veteran and you enjoy using the VA and a VA is close to you, that's fine, you can do that. If you're a veteran like me, who doesn't have a facility close to them and doesn't want to wait 60 to 90 days to get their hernia repair, you could go and get that procedure done right away. So that's some of the challenges that we've seen. The Mission Act was good. It passed before I got elected to Congress. It was a great bill. I would support it if it was being voted on today. But it's like Darin said, it's kind of a step in a direction that we need to go for true choice for our veterans to go where they need, when they need it, to get the health care that they deserve.
Well, and now, Darin, if you would, please expand on that. If you could kind of talk about some of the things that CVA has been seeing with the challenges of wait times and how it's been reported by the VA.
Yeah, so wait times are critical because eligibility for community care is based on wait times. You don't have an accurate wait time, the veteran, and by law, VA is required to report accurate wait time to the veterans so they can make the determination themselves whether they want to go in the community. We cannot get, and there was a FOIA from the TV reporter Walt in Tampa. I know SFAC has done requests. We have done FOIA requests. No one's been able to get VA to actually report an accurate wait time. What I mean by that is the accurate wait time is from the veteran's date of request. So from the time I pick up the phone and I say, hey, I need a primary care appointment, or I need a dermatologist, that's when the clock starts. VA is still not reporting any wait times based on that. And whenever anyone asks for it, they don't. And even with that, there's been testimony, GAO reports, and VA is taking on average 19 days just to go ahead and process the authorization before they even go to the community to try to schedule an appointment for you. And then on the average appointments, because of that, it's then taking close to 42 days. So it's ridiculous. And of course, you have, not just the congressman, but, the Massachusetts delegation, the Washington State delegation, you have those problems. So it's critical. It's starting to look like 2014 all over again, where they don't want veterans to go out. So they're playing games. Congressman gave a good example of one of the playing games. They cancel the appointments, they reschedule, they're not following the wait times. There's quality issues. CMS does a quality compare. So look, there's lots of reasons to go to the VA if you're happy with it, but if you're not happy with it, if you're, for example, in the state of Tennessee, and you are in Memphis, CMS ranks the Memphis Medical Center for overall quality as the worst one out of 23 medical centers in Memphis. Why shouldn't you have the ability to go somewhere else rather than the worst quality? With the True Choice Act, you do. You pick the other program that works for you, and you have whoever's in the network, you have the ability of that PPO to pick whoever you want. And if they're not good, you pick somebody else. So, if that's the way it works with regular healthcare, if your provider is too slow, you're not quality, you go pick somebody else. I've never had a problem with the private sector provider. If they're on vacation, they say, hey, we got Joe instead. He can see you in 3 days if the other guy's on vacation. That's the way it works. That's the way why this is so critical. And that's why wait times are critical, so that veterans can make a valid decision about what's working for them and have the choice to make. That's critical.
Well, thank you, Darin. And again, for those who are just joining the conversation, my name is Jimmy T. Smith. I am the Florida Coalition's Director for the Concerned Veterans for America. And we are discussing the Veterans True Choice Act and the future of veterans healthcare with the sponsor, Congressman Greg Steube from Florida's 17th District, as well as Darin Selnick, the Concerned Veterans for America Senior Advisor. So, Congressman, having heard what Derek was just discussing, when he was exempling the 19 days even to get the process started, or subsequently 42 days to move it forward, what do you think this legislation will do to give the veterans a better option when it comes to that? Because it sounds like that's probably what is causing veterans not to get the care they earned.
Yeah, 100%. When you have to wait 30, 60 days to get an appointment, and then you go to the appointment and then they're saying, oh, okay, well, yes, you definitely have to go to now an orthopedic or a specialist or something else. Then you got to wait the 30 to 60, 90 days to do that. This bill would allow that veteran to make the decision right away and go to the doctor that he needs right away. And I think another good point that Darin kind of hit on was your choice of physicians. So like I said, over the years of going to the VA, I've never had the same doctor when I've gone for my primary care appointments. Well, if you feel comfortable with the orthopedic surgeon that you have in Sarasota County or wherever you live, then you should be able to go to that person. If you go through the VA system, when you have your initial consult, it may or may not be the same physician or surgeon that's actually going to perform the surgery on you when you show up 30 to 60 days later for that procedure. So those are some of the other challenges that you face. Is healthcare should be about a doctor-patient relationship where the doctor knows you and you trust that doctor to perform whatever care it is that needs to be performed. And so there are a lot of veterans out there that don't feel comfortable using the VA for more specialized services, and they would have that option. Hey, you do need a hernia repair, you need your knee scoped, or you need your knee replaced, your hip replaced, or whatever that is, and you have a relationship with a surgeon there in your community who you trust and you want to have that procedure with. The VA won't cover it if it doesn't meet these time periods and distance requirements, they force you into the VA system. This bill, this true choice bill, would give that veteran the true choice to go wherever he wants with a doctor he feels comfortable with. And as long as they take TRICARE, it'll be covered by the federal government.
Well, thank you very much, Congressman. And Darin, to you, how do you feel this bill, because you've dealt with the veterans healthcare issues within government itself, within the VA as an advisor and now as a senior advisor for Concerned Veterans for America, how do you feel this bill sets the stage for modernizing the VA system to put in more sustainable path for more options and higher quality of care for veterans going forward? And we know that this is really a great piece of legislation. How do you see this sets the stage? Because it's always about the next step of improvements.
Yeah, it's critical. VA is the only federal program and pretty much the only healthcare that's still based on a 1996 model. So modernized by, look, if you go to an employer, you're going to have multiple plans that you can pick from. If you're a federal government employee and you're an FEHB, you have many plans in your state to pick from. If you're at the VA, for every other benefit, you get to full freedom and choice to pick what's best for you, whether it's a loan, whether it's your GI Bill, education, etc. So this is key, because VA has 20 million delayed canceled appointments from last year, and that kills. Clinicians are more concerned these days about your delayed care than COVID. And so this modernizes it by putting the VA healthcare benefit on the same par as all the other federal benefits, and giving you the same choice, that full choice that every other healthcare program has. So it's critical to take VA from a 1990s model and a kind of a TRICARE Prime model, which to where DOD and the rest of the federal government and the rest of the country is today. DOD left this old model in 1990s. It's time VA starts joining the 21st century and give veterans veteran-centric options to pick the care that best works for them. So it's absolutely critical.
Well, that's awesome. Well, Congressman, let me go to you and kind of expand on this a little bit, because we know that as people like myself and Darin who are retired, when you talked about getting your doctor and going into your doctor, we know for a fact that somebody like myself who did actually have a hernia surgery through the VA, I did have to take a longer process. But when I went to my doctor, because of TRICARE, I was able to get that turnaround time faster. Do you feel that that would answer the calls from your constituents about some of the challenges that they face? Do you feel that this legislation directly will be able to benefit your constituents in your district?
100%. And I'll give you a quick example from a veteran in my district. So I represent Charlotte. I represent 9 counties in Florida. One of those counties is Charlotte County. And in Charlotte, they just have a clinic. So if it's something more than primary care, they have to refer you down, and they'll either refer you down to the hospital in Lee County, or you'd have to come up to Bay Pines and Pinellas County. And there was an individual who needed hearing aids, and they didn't particularly do what he needed done there in that clinic in Charlotte County. He had to wait 30 or 60 days. Then he had to drive all the way down to Lee County just to get a set of hearing aids. And by the time he had the appointment, did all the things he needed to do, I think he said it took him 6 months to get a set of hearing aids. So that type of thing wouldn't happen if he had TRICARE and he's over the qualifications for the disability over the 30%. He could go down the road that day to somebody that gives him a hearing aid. He can get it. They take TRICARE, good, it's covered, and he's got his hearing aid. So it saves an incredible amount of time. It saves an incredible amount of having to drive distances. And for some veterans, they either don't have a car, they're on limited income, or they have to take a van or some type of public transportation to get to a hospital. And if it's a 2-hour drive, that's a significant impact on them. I know Bay Pines has a shuttle that they operate for some of these veterans, but again, you're having to wait on the shuttle. You're gonna have to coordinate that with the times that they're gonna be able to see you at the VA, and then the time that the shuttle is gonna be able to come and get you and then take you to the hospital. If True Choice passed, you go right down the road in Charlotte County in Punta Gorda to a physician there for your hearing aid and get it done the same day. And boom, you've got your hearing aid, and not have to go through this back and forth and all of this challenges and wait that period of time for the healthcare that they need.
Well, Congressman, listen, I know your time is very valuable, and you have given us an abundance of it. And I want to say, first and foremost, as somebody who was able to work with you in the Florida legislature, that we love your passion for veterans as a fellow veteran, and you yourself being a veteran. We thank you for that. We are truly in support of your legislation. I think this is definitely part of the plan to move forward to give veterans the health care they earned. And a lot of them will benefit from this legislation. We greatly appreciate that. So if you want, would you be willing to go ahead and just make some quick closing comments and kind of talk about what you think is maybe this and the next way forward?
Yeah, I would just encourage anybody watching this to reach out to your members of Congress. If I'm your congressman, obviously you don't have to reach out to me, but if you live in the country or somewhere else in Florida, reach out to your member of Congress and encourage them to co-sponsor this piece of legislation. It's HR 364, the Veteran True Choice Act. And you can just say Congressman Steube, and they can reach out to my office, because if we have more members throughout the country that support this, it has much more of a likelihood to pass. So anybody watching, reach out to your members of Congress and encourage them to sign on. Thank you guys for having me. Great to see you, Jimmy. Thank you both for your service to our country. And it's an honor to serve and have the opportunity to help veterans across our country.
Thank you very much. And with that, it's been an honor to talk to the congressman, and CVA does support HR 364, the Veterans True Choice Act. And we do suggest that if you're watching this, regardless of what state you're in, that you reach out to your congressional delegation and ask them to support this legislation. This legislation actually is the next step in veterans healthcare. And we feel that with some of the challenges of the Mission Act, that you must continue to fight for improvements. We want full implementation of the Mission Act, but you don't stop there. And we are so blessed to have Congressman Greg Steube, who is leading the next step in improving healthcare options and choice for the care that veterans earned. Darin, if you would, go ahead and I want you to just make whatever wrap-up closing statements you want, and then I'll let people know how they can get a hold of us if they want to.
Great, thank you. I'd like to echo what the congressman said. It's important members respond to what constituents say. And so they want to have solutions. So please contact your local representative, your local senator, whoever's seeing and watching this, get involved. You can join up with CVA, will help you out, Jimmy and the team. But it's real important people get vocal, and and not just say it's a great idea, but you gotta talk to others, they've got to talk to their representative, and they got to really push hard. Veterans deserve this. Literally, for some veterans, their lives are depending on this legislation, because too many veterans in the past, from the Phoenix scandal to today, have literally died from delayed care. We cannot have that anymore. So once again, thank you, Congressman, for putting together and leadership on this. But please, people, we need you to be active. We need you to go out there and tell your congressmen, your friends, your member on the Hill, support this bill. It's very, very important.
Thank you, Darin. And your service to the nation doesn't end upon you leaving your active duty. It actually is service to the nation for the rest of your life. And the way that you can serve your nation is by working with organizations like us at CVA. And you can contact us at cv4a.org. That's Charlie Victor 4 Alpha.org for our military-minded individuals. You can find us on Twitter at Concerned Vets. You can find us on Facebook at Concerned Veterans for America. If you want to text and get involved and help with completing the mission and getting the Mission Act fully implemented as part of the overall healthcare process, you can simply text 46262 and the word complete the mission, all one word. And this will give you that ability to support getting the healthcare to work right. Now, we truly, again, support and appreciate Congressman Steube's effort, and we thank you for joining us today.